Polite, a 16-year-old Southern belle from Mississippi.
This time I was at school and somebody was just scuffling and hit me in the back. So right then I just felt, a shock just go down my spine, and I knew something had happened.
What happened to Candace Baker was a triggered flare-up, a terrible side effect of a chronic pain disease called Rsds.
It's almost like you've been stung by a bee or something, like
Actually, I've had those sensations. It feels like wasps are just stinging my foot all the time. I can actually feel people getting close to my foot. It's that hypersensitive.
14-year-old Marissa Williamson from Illinois is also an Rsds patient, a patient of Dr. Donald Rhodes, a local podiatrist in Corpus Christi who treats the disease in an unconventional way.
Other doctors back home, all they wanted to use was narcotics, and eventually those things will kill you. So here we take treatments without the use of medication.
What it does is, by stimulating acupuncture points, acupressure points, reflexology points, as well as free nerve endings and nerve trunks, it stimulates these guys to create what is missing in your body.
Hooked up to the strategic nerves in the feet or hands, send electrical impulses up nerves to the place in the back that controls the sympathetic nervous system, the nerve system that makes your body do things you don't think about.
Diseases that respond to this treatment are grouped together by circulation. If we can improve circulation, good things happen.
Well, right now I'm pain-free, and foot looks good, my foot feels good, and I'm ready to go home.
How about your right hand?
Oh, I can use it too.
And how long has it been since we could use it?
It's been a year.
Well, when she came here, she was in a wheelchair, and her foot was all swelled up and discolored, and we didn't really have anywhere else we could go with her, so we dropped her off here. I did. She's been here since late April, early May, and now she's up walking around doing very good. Her foot looks almost normal. It does to me much better than it has in months and months. And as usual, when we bring her here, we've kind of waited around until the last minute when we get her here, and when she leaves, she's always leaving better.
Then after I started treatment, I got a lot better. My temperatures went up, I started feeling better, and today I'm pain-free for the first time. It feels great. I no longer have any pain. I'm really excited, and I'm really glad I came to get this treatment done.
From the very first day, I had color back to my hands and to my feet and to my neck within 4 hours.
Well, sir, as a physician, I've always been somewhat viewed alternative methods of treatment with somewhat of a jaundiced eye. We came here within 24 hours. She was off of her narcotics. She had a smile on her face. She was much improved. I can't explain the pathophysiology of how this works, but something worked for my daughter, for which I'm very grateful. I had always been taught that unless a problem could be solved with a sharp knife or the taking of a pill or a potion, it probably wasn't treatable, but I am going to have to change my thinking a little bit.
After 4 months of dealing with 15 different doctors and her getting sicker and sicker, that we realized that she had RSD. In turn, as she kept getting worse, she could not hold a glass of water. She could hardly feed herself. She basically screamed and cried and laid on the floor. That's all she did all day. So I called and I talked to one of the techs, and they were real quick to get information to me, let me talk to some other moms, and within a week and a half we were here. And 6.5 weeks later we got to go home pain-free, and she was doing great, and she was off all medication. And that's one thing that took longer while we were here, was because he took her off the medication very slowly.
We're heading in this door, the brown door right here. Of course, we didn't catch you skipping down the hall like you were a minute ago, but
my pain is reduced a lot.
I'm not on any drugs. My head is so much clearer, I don't feel stupid. I became severely allergic to nuts at the beginning of all this, about 4 years ago, and now my nut allergy is greatly reduced. I became allergic to dairy. I can eat dairy again. I was having a lot of stomach problems. My stomach problems are gone.
Just so happy that I'm finally at the place that I am.
And after the first day I was feeling much better, and each day got increasingly a lot better, and now day 15 I have no pain.
Came here in a wheelchair, walked in with the cane, and about the third day I left the cane at home. You put the orthotics in, and that's the best I've felt in 10 years.
I apologize, I know this is going to be tender, but if we push on here, even with the non-weight bearing, we have pitting edema. It's still there, still there, still there. I'll tell you when it's gone because there's a timer running, correct, in the camera. Still there, still there, still there. It's still noticeably present. Continuing, still there. We're beyond 10 or 15 seconds by now. Well beyond. We'll come over here. I'm going to push in, and I'm not getting funny faces like yesterday. Let go. It's the color is already back. The edema is virtually, the little pit is virtually gone.
You having no pain, no burning, any symptoms at all?
No.
Okay, everything A-okay.
Mm-hmm.
Okay.
When I first started coming here in 2001, I was on so many drugs. It's just really, really amazing. So he's just, I love coming down here. If it weren't for him, I wouldn't be me. And that's what keeps me going, because I know that there's light at the end of the tunnel, and this year is going to be, I'm going to get to that light.
And we were told that it was all in his head. We had countless doctors that were telling us that it's all his imagination. He needs some severe psychiatric counseling.
Yeah, I honestly believe that we would have lost Nathan if it wasn't for Dr. Rhodes.